Thank you, my friend Akasaka. Your Excellencies, ladies and gentlemen, it is an honor and privilege for me to be here today. Allow me, on behalf of the UN Secretary General, to thank the city of Melbourne, to thank the people of Australia, and particularly also to thank all of you who have been traveling to come for this important gathering. And I want to thank the city of Melbourne for hosting this timely conference, like my friend McMullen said. It's timely because just 3 weeks before the summit on MDG. It is very important to have you here, people who are representing the voice of the voiceless. I want to say that MDG is not just a goal, it is a movement. We are uniting the world together. It is not just about a number. I remember just a few months ago, traveling in the northern part of Uganda, meeting a young girl, 13 years old. She was kidnapped by one of the worst barbaric rebel groups. She was raped. She found herself in a rehabilitation trauma center managed by an NGO. And when I met her, I realized that she was pregnant and HIV positive. When I was about to leave her, she told me, why me? What I did do to deserve what is happening to me today. And I think that is the call for MDG, because it is a call for peace. It is the call for making sure that we have an inclusive society. It is a call for health for those innocent people who are just lacking all type of support. But allow me to just say that the AIDS story is a story about outrage. It is a passionate call for social justice, for redistribution of opportunity. 3 decades ago, you were at the few people. I'm just thinking about these activists, the movements you have been generated. You were there, where nowhere were there. You were there asking to your government, pressurizing, asking to research groups to make sure that we can break the conspiracy of silence around this disease. It's you who have been able to help us to negotiate the price of the drugs. Remember, a few years ago, it was $14,000 per person per year. Today, we're talking about first-line drugs, $80 per person per year. This is a social transformation which would have never happened without your activism, without your commitment for public health. You have been not just doing that. You help us to mobilize financial resources. I remember 10 years ago when I was joining UNAIDS, we're talking about less than $500 million to fight HIV/AIDS. Today, we are talking about $16 billion. That would have never been possible without you. Those resources help to produce results for people. In the last 5 years, we have been multiplying the numbers of people on treatment by 12-fold. From less than 500,000 people. We have more than 5 million people on treatment today. We have been reducing the new infection by 17%, averted 400,000 new infections in Africa alone. I just came from Papua New Guinea, where I was observing with a lot of interest what was happening there. With your support, Australian government and others, you are experiencing today a decline in the prevalence rate on HIV. All of that I want to just to say this meeting is a very important meeting, and I'm so happy that Akasaka and their team and yourself have been working hard to make it possible, because we know that it's impossible to reach the MDGs goals without having an inclusive governance system. You help us to change that system. Today, you're almost in every single policy debate. You're involved. You're influencing the decision. You're making sure that the policies are defined to have the poorest segment of the society needs in the centers of what we are doing. You have been pushing for universal access, and not as a luxury, but as a way to reach people who are unreachable. In the most remote areas, your delivery system you have been putting in place help us when the government is not capable to reach those people who are criminalized, those people who are hiding themselves, who are going underground because their social status, or because for what they are or who they love. You have been able, with your delivery system, to create alternative service delivery system, to expand the implementation of programs to reach those people. I want to say that it is time to harness the passion and the expertise you have been developing during the last 30 years. You're the only disease which has been able to create a social movement is HIV. But it's time to take AIDS out of isolation. It's time to use this energy to build a bridge, to make sure that at least we have integration with others' goals. It is not possible to deal with AIDS alone and to feel that we will achieve the Millennium Development Goals. We need to use all these resources, energy, to leverage and produce broader health and development outcome. The MDG 2, 3, 4, 5, 6 are an indivisible set. And that's why we have been calling for a virtual elimination of mother-to-child transmission, because we think that is not acceptable to have 400,000 babies born every year with HIV in a developing world when it's not happening anymore in developed world. And we know that these goals can help us to link the whole maternal health, child health, reproductive health, engaging men, looking on way to fight against all those discrimination, and making sure that we can build a health system which could be sustainable. We want also integration between TB and HIV, because we know that it is two diseases, but it is only one life. That will bring value for money, cost effectiveness, and it will help us to produce the result we are all expecting at a lower cost. And that is the beauty of what we are trying to achieve. And the Secretary General, a joint action plan for maternal health is exactly the sort of a cross-cutting initiative. we at UNAIDS have embraced. Our vision is very simple. Our vision is nothing less than zero new infections, zero discrimination, and zero AIDS-related deaths. We will reach zero only by harnessing the dynamism we saw throughout the fight against HIV/AIDS, the creativity, reach, and your skills of all those NGOs, civil society groups, as one energy, as one force for transforming the public health debate. And I am so happy that I could have joined you today in Melbourne, and I want to thank you.